Today I decided to record this case. I think it will be interesting to show how can we move this premolar buccally, create space for it. So let's begin. It's a very good case for clear aligners. And as usually, we start with this step called change local origo. And here we check the axis of the teeth. My technician has already done some preparations, but he is not very accurate with the roots positioning. And this is the doctor's responsibility to check all the axes, to adjust them, because it affects on the treatment planning. That's why it's our responsibility, and we always have to do this. So here I'm going to expand, and that's why I place the axis this way, so that the tooth goes straight buccally. When I use bodily or tipping buccal movements. Oh, here we have long roots, which is not good for us because the movements will be more difficult for aligners. We also have short crowns, which is also not good. So we'll be slow and accurate here. And left molars I'm going to distalize with the distal tipping movement. That's why I place the axis this way. So it's so I follow the tooth anatomy. Well, let's check the torque. Torque is fine, and we can proceed with the upper jaw. They will have to extract this third molar before we start the treatment. Now we do same on the upper jaw. I'm not a big fan of improving these small rotations of the premolars, so I just expand and leave these small imperfections as they are, because it's more stable and it doesn't affect the aesthetics. I think here we also can make some distalization to reduce the IPR in this area. Also long roots. Okay. We use a good plastic material. I'm going to use a Zendura Flex here. And by the way, in a few weeks I'll get my graphy stuff. And I'll use graphy material for my complicated cases. Not for cases, for movements. So I can combine, I can, for this case, I can start with Endura to perform the difficult movements and then finish with the Biolon or Veralite with some simple PETG material to save some money, because Endura is it's really expensive and it's not necessary for simple movements like tipping and rotation. Okay. Let's go to virtual setup. And we'll start with the lower jaw. Let's turn the gingiva off. And start. How much space do we need? I think about 2 millimeters. So in degrees of tipping, it's gonna be about 10 degrees, I think. Yep, about 10 degrees. So we make half layer 1 and start to procline the frontal teeth. Not only the frontal, we can also start to make some buccal tipping for the right side. So I don't want to go faster, then I go with the molars so that I don't increase the quantity of aligners. I always try to make as less aligners as I can. That's why I'm following these movements to make sure they're not faster than the molar distalization. Layer 2. So here we move the second molar to the final position. Let it be minus 10 degrees. And start to move the first molar for the second half. And expand a little bit. Oh. Proclining the incisors more. Buccal tipping for the right side. Layer 3. So I place the molar to the final position. And I can start making a distal tipping for the second premolar. And proceed with the tipping, with vestibular tipping of the frontal teeth. Here are some mesial tippings. Since we have some anchorage, it's an okay movement here. Let's check the root. We're inside the bone, it's good for us. Add some more expansion. Okay. And at layer 4 we can start. No. At layer 4 we can start moving the first premolar and finish moving the second premolar. I think there is still going to be some IPR here. We will divide this movement to a few stages. So if I do it in one stage, distal tipping and vestibular tipping, there will be like not good direction, not good vector of movement, because there will be an intersection, and we will have to make an IPR for too much, in my opinion. It can be harmful for these teeth. So first of all, we distalize more, and at the layer 5 we are going to move it to the vestibular direction. And yes, some IPR is still needed here. I guess I should increase the amount of distalization. So let's get back to layer 1, make it -7, layer 2 -14 or 13, let it be. Here -7, layer 3, reset this tooth, move the first molar to the final position, like that. Layer 3, this one for -7, up, reset. This one here, and at the next layer this tooth will go here and this is will go there. Okay, looks better. It was layer 4, layer 5, some vestibular movement of the second premolar. Is there some bone? Yes, fortunately, yes. And we can make some distal tipping of the first premolar. Layer 6. We are moving the canine to the vestibular direction. And we can make some more IPR here. Move the incisors up. Now, this is our limitation. We see the root through the bone, so it's time to stop to procline. From this point, it was layer 6, layer 7. Align the frontal teeth. We can start to move the incisors backwards. And layer 8 is going to be our final layer, where we close all the spaces by tipping the frontal teeth to the lingual direction. And now we will make the upper jaw. Remove the gingiva, turn the bone on, and make some distalization. Here. It will improve the contacts. And we'll get some more space to put this second premolar more buccally. So the same protocol. Oh, what was it? Ah, my technician was wrong, and he mixed the center of rotation. He set it to the middle of the crown, but when we work with the liners, we have to set it in the middle of the root. So we go to rotation center root, 70, apply to all. So he set it for 70%, because by default it was 50, but he forgot to set it to the root. But it's not a big deal for us to go to change local origo and replace this central rotation so that our movements will be more biomechanically correct. Well, I don't need bodily movements here, so I'm not going to add any elastics here to the like second class. So we'll make just tipping movements, and distalization should work fine here. So since we made 3 degrees here, we should keep this number not to exceed it, to keep the number of liners. Some expansion, but not more 3 to 3.6 degrees. Just expand everything for approximately same numbers. Layer 2. Make some more tipping. Start to move the first molar. Some expansion, blah, blah, blah. And expansion on the opposite side. But I don't expand these premolars because there is an intersection and I want to wait until it's fixed. Layer 3. Here we put the canines to the final position. And let's check the contacts. Ah, here we see the root. So we're not going to make any bodily movements. We'll replace them with the translation. So I get rid of all the bodily movements. Okay. Yep. And we can start to distalize the second premolar. Looks good. Let's check the contacts now. I think we don't need more expansion on the right side, but we still need some on the left side, on the second premolar. Well, let's go on. Let's go on. Layer 2, difference between 2 and 3. Some expansion. We can choose few teeth at the same time and 3 degrees of torque. And then add some rotation, meso-distal movements if they are needed. And yep, they are needed here. Distal rotation of the canine. Layer 4. Moving the premolar. And checking the contacts between them. I think they are good. So we start to move the first premolar, distal tipping and some expansion. Here we see a sagittal gap, which is good for us because we're going to recline the lower incisors at some stage, so we'll need to have some sagittal gap to let this work. Something like this. So it was layer 4, then layer 5 of the premolar. Let's add some body movement. Then the canine starts to tip distally. I already noticed that we created too much space, so let's reduce it this way. Recline and rotate. Distribute the space in the frontal area. It was layer 5, 4, 5, layer 6. Distal tipping and some minor palatal tipping. Working with the incisors, so we can start to move this incisor to the palatal direction. And let's make the final layer where we close the sagittal gap, close all the spacings we've created. I'll ask the doctor to grind the distal edges, the distal part of the incisal edges of the central incisors to improve the aesthetics. Creating the tight contacts on the incisors. Some overcorrection of the midline, which is fine for us. It's a visual artifact. There is not going to be any spacings, but Maestro is not good at morphing the gingiva. We can tip the canine more so that it reaches the antagonist tooth. Okay, I think we can finish. And check the overcorrection. Let's add some intrusion here. And yes, it's time to check the overcorrection. Let's go to layer 0. So the laterals was more lingually, so that I have to be more vestibular at the final position. And we apply the opposite logic to the central incisors. So since this tip was more vestibular, we put it more lingually for 5-10%, but it's very crucial. They don't look straight, but this is how it should look like. The liners always need an overcorrection. And here we check same. Not to overcorrect. And we can make some virtual chain. To make sure that our contacts are tight. Once we've done with the overcorrection, we can go to the attachments. Here we can replace some tipping movements with the bodily movements because the crowns are big. We can achieve some translation here. It's not impossible. Yeah. So from now we can start placing attachments. We have big crowns here. So big crowns means good retention, but we'll make some retentive attachments to the first premolars to keep the liners more tight, fit on the frontal teeth. Yeah, by the way, this is what we always get when we distalize the lower teeth. We'll always do it with tipping. We cannot intrude it because we just don't have enough anchorage. So how can we intrude with just a tip of an aligner? It's not possible, we don't have enough force. So we think that the occlusion will help us and the intrusion will happen from biting with the antagonistic tooth. Or we can use some mini screws or some other techniques. But with just aligners, we are not able to intrude the molar. It's not possible. But it will be intruded by the natural forces when we finish the treatment. I also give my patients chewies so that they help us with the intrusion as well. Do we need some other attachments? I'm not sure, but let's put some let's put some double purpose attachment here, so it will work in two ways. It's going to be a retentive attachment as well as the attachment which is going to help us with this distalization. No, I'll change it to this shape, which I like more. It's not good for retention, but I hope that the anatomy of the crowns will help the retention. And I also believe that the doctor will use pliers to increase the retention in this area, because I know he has the pliers from me. I don't think we need any attachments on the upper jaw, maybe here. We don't need attachment for distalization because we have very big natural surface of the molars. So imagine if we just add an attachment here. Does it give us any sense? I think no, because we can push here, 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 and there. And on the second molar it's the same, so we don't need any artificial surface here. So I'm not a big fan of placing a lot of attachments. I always try to avoid them if I can. I don't like this position of the canine. Let's maybe leave it a bit farther. We also need attachments on the canines, which we rotate. So that we need 3 attachments for rotations of the canines. And I prefer to use these triangles. I saw some doctors on Instagram use them, and I started to try these attachments. I like the results, and that's why I use them very widely. So if rotation is in the distal direction, we put it more to the mesial side. Here we put it more to the distal side because rotation goes to the mesial direction. And here rotation goes to this direction as well, so we put it more distally. Don't forget to put the numbers to some posterior teeth. What else? Let's see if we need a negative attachments. Do we need a negative? I think yes, we do. Let's check. Where? Actually, I don't think we need them. Maybe here at layer 5 or 6. I think, yep. Let's put the negative attachments at layer 5 and layer 6 to help this flutter incisor to go to the vestibular direction, to go to the mesial direction as well, and to rotate. Negative. Then we go to layer 6, right click, restores previous layer. And upper jaw. I think we should help this rotation. I forgot to add these movements and this layer. F5. And from layer 6, we'll replace the attachment. We'll put it to the another part of the tooth. And the final layer, also put it here to the distal side. Okay. Let's see how many liners do we need to produce and turn the animation on. I thought it's gonna be a shorter case, but now I see that we need to make about 30 sets of trays, but let's see. Rotation less than 1 degree, distance 0.23, distance 0.22, 0.21, 0.24, 0.23. Wow, it's a long case. 0.23, 23, and 0.24. Wow, it's a long case. $42, wow. But we don't have any other options. I tried to save as many aligners as I could. Three, 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 three. Let it be 4 and 5. Less than 42, but it's still a long case. Now it's time to turn the animation on and check. How it looks like in the dynamics. Well, let's turn on the point of view from this angle. Step-by-step distalization, proclining, and retraction. 1, 2, 3, 4, 5. Okay, then. Distalization, expansion, round tripping. One more time. Okay. We'll have to synchronize the movements, because if the patient is wearing the liner simultaneously, so he'll finish the upper jaw treatment at the liner 24, but the lower jaw liner 24 is it sets the teeth to the proclined position, so we'll need to reduce the we'll ask the patient to, let's say, change the aligners maybe once a week for the lower jaw and once in 2 weeks for the upper jaw, something like this. So the movements go more synchronized, more simultaneously, and there is always some sagittal gap so that the lower teeth can expand, because they expand until the liner 35 or even 38. So we'll have to, but the upper jaw, they expand only until the liner 15, so we'll need to keep some sagittal gap. Until the lower teeth are proclined, and we will need to make some custom schedule of the change of the aligners. And the final check attachments, if there's some bite. I think no, it's closed, but now it's fine. First of all, I export the setup from Maestro. In order, if something happens, I always save all the setups so that I can open them on any other PC. And if something happens, if my computer breaks, I don't know, if I spill water on it, I don't lose my database. It's super important. And then I upload this case to the web viewer. Well done. Thank you for the time spent with me.